Hi students, welcome back to my channel. I hope you all are doing well. So today we are back with very important topic, and that is Sjogren syndrome. It is important for your short note type question, long note type question, for your Viva point of view, as well as for NEET. So basically this topic is very important. It can come in a short note, long note form, or it can be asked in your Viva as well as in MCQs in NEET exam. So let's see what it is. Sjogren syndrome is autoimmune disorder. Okay, it is an autoimmune disorder. So let's see what are the contents of this topic. So here in this video we will be covering about types of Sjogren syndrome, that is primary, secondary, clinical features, investigation, treatment, cytography, and a lot more. So let's see. First of all, Sjogren syndrome is an autoimmune disorder. Okay, it is of two types, that is primary Sjogren syndrome and the secondary Sjogren syndrome. In primary Sjogren syndrome we have xerostomia and xerophthalmia. Xerostomia means dry mouth and xerophthalmia means dry eyes. Okay, so in primary Sjogren syndrome only xerostomia and xerophthalmia is present, means as compared to the secondary Sjogren syndrome, it is not associated with any of the systemic diseases like rheumatoid arthritis or SLE. What is SLE? It is systemic lupus erythematosus. Okay. So in primary we have xerostomia and xerophthalmia alone, and in secondary Sjogren syndrome we have dry eyes, dry mouth, and it is associated with rheumatoid arthritis and SLE. Okay. Then we come to clinical features. What are the clinical features of Sjogren syndrome? Obviously, dry eyes, dry mouth, mouth mirror. There is a mouth mirror test in which the mouth mirror it sticks to the buccal mucosa. So it is called mouth mirror test. Then we have lipstick sign. Tongue, it becomes smooth, shiny with a loss of papilla. Okay. Pain and stiffness of small joints like carpals and metacarpals. So these are the clinical features of Sjogren syndrome. Now, how we can find out the Sjogren syndrome? There are certain investigation for it. So there are lab investigation, radiological or cytographic examinations. So let's see one by one. So in lab investigation, we have anti-nuclear antibody. Then we check for C-reactive protein or RA factor. Then we check for anti-SSA and anti-SSB antibodies. Now let's see one by one. ANA, that is anti-nuclear antibodies. If ANA is present, if during the investigation ANA is present, then it means patient has an autoimmune component. So it means there are chances of a patient having Sjogren syndrome. Okay. This ANA, that is anti-nuclear antibody, it is mostly increased in case of SLE. This is very important question. It has been asked in NEET. So just learn this point. Anti-nuclear antibody has been increased or raised mostly in SLE. Okay. Now we check for C-reactive protein and RA factor. If C-reactive protein and RA factor is also raised, means patient has rheumatoid arthritis. Okay. And by presence of rheumatoid arthritis, what it means? It means there might be chances of patient having secondary Sjogren syndrome. As we have seen in primary Sjogren syndrome, it is not associated with any of the diseases, means dry eyes and dry mouth are alone. But in case of secondary Sjogren syndrome, it is always associated with rheumatoid arthritis, SLE, and so on. Okay. Now third we have anti-SSA, anti-SSB antibodies. Anti-SSA also called anti-Rho, and anti-SSB also called anti-La. So if these two antibodies are present, means that this is the confirmation. This is a confirmation that there could be Sjogren syndrome. Okay. And it is also a NEET question, star mark. this anti-RO and anti-LA, these are the autoimmune antibodies. Okay, so it has been asked in the NEET examination. It is autoimmune antibodies. Okay, so there's next question. What is the confirmatory test for SS, that is Sjogren syndrome? It has been asked in the NEET. So what is the confirmatory test? Lower labial gland biopsy. So there will be biopsy of the lower labial gland that shows the confirmation for the Sjogren syndrome. What we see in the biopsy, there will be increased lymphocytic infiltration. If there is increased lymphocytic infiltration in case of biopsy, so that confirms the presence of Sjogren syndrome. Okay. Now there are certain important tests to check for xerophthalmia, that is dry eyes. So first is SRB, where S stands for Schimmer's test, R stands for Rose Bengal dye test, and B stands for breakup time test. So these tests are very important. They can also be asked in your Viva point of view as well as in NEET separately. Okay, when you have asked this question, when you have been asked this question in short note form or long note form, then you're supposed to write everything. Then apart from it, there are certain pointers in this topic that can be asked separately as a Viva. They can be a question of a Viva as well as in your NEET exams. Okay. Now we have ciliography. What is ciliography? Ciliography is a radiographic examination of salivary glands, especially parotid and submandibular gland. In this ciliography, we basically inject a contrast dye or a contrast agent into a salivary gland duct, and then we take X-ray image to visualize the ductal system. Okay. So in Sjogren syndrome, when we visualize the X-ray, there is appearance of branchless fruit laden tree appearance, cherry blossom appearance, and snowstorm appearance. Okay. Now let's see what is the treatment for it. For xerophthalmia, we give pilocarpine eye drops. For xerostomia, we give salivary stimulants and salivary substituents. And there is lot more. For rheumatoid arthritis, we give corticosteroids. Okay. So there is a very important information on Sjogren syndrome. If the Sjogren syndrome comes in short note form, then you're supposed to write as it is, having said that, as it is, this much content is sufficient if the question comes for 5 marks or 3 marks. But if the question comes for 8 marks or 10 marks, then you're supposed to include certain things in your answer. And what are the things? You will be writing about xerostomia and ciliography in detail in order to get good marks. Now you guys have to tell me if you want a separate video on xerostomia and ciliography. I would love to do that. So that's it for this video.